I'm Arthur Klatsky. I'm from Kaiser Permanente Medical Care Program in Oakland, California. And I presented some data about coffee drinking and risk of dying from stroke or of having incident stroke. We studied a large population of 130,000 people who had health checkup examinations 20 to 25 years ago. At those examinations, they gave information about a number of things, including their coffee drinking habits. It turned out that the more coffee people drank, the lower the risk of dying from a stroke seemed to be. And in fact, people who drank 4 or more cups of coffee per day had a 20% lower risk of dying from stroke than people who drank no coffee at all. This was true for the various types of stroke, ischemic stroke and hemorrhagic stroke, and it was quite independent of a number of confounders that were controlled for in the analysis, including, importantly, cigarette smoking, which is correlated with coffee drinking, and baseline symptoms or evidence of cardiovascular disease. Now, despite the lower risk of dying from stroke, there was no lower risk of having a stroke that was not fatal. So it seemed to be specific for death from stroke, and we therefore speculate that the coffee, something in coffee, most likely caffeine, protects the brain from damage and reduces the risk of death. In other words, that caffeine may be neuroprotective. The advice to people would be that there's no harm, certainly, in drinking coffee if they're at risk of stroke. I don't think we're about to recommend to people that they drink coffee for the benefit, but they don't have to avoid coffee entirely.